Proportional Assist Ventilation Plus, or PAV Plus, is a form of synchronized ventilator support in which the ventilator generates pressure in proportion to instantaneous patient efforts. The ventilator simply amplifies inspiratory effort. Unlike other modes of partial support, there is no flow, pressure, or tidal volume set. PAV Plus's objective is to allow the patient to comfortably attain whatever breathing pattern his or her control system desires. The main goals of PAV Plus are synchrony and adaptability through the automated measurements of both demand and respiratory mechanics. Percent support is your primary setting. To understand Proportional Assist Ventilation Plus, or PAV Plus, we must first understand some of the physiology behind normal respiration. When we take a breath, the diaphragm must work to overcome a couple of specific forces. Those are the elastic and resistance forces of the lungs and thorax. PAV Plus will uniquely monitor changes in elastance and resistance by performing automated random measurements every 4 to 10 breaths. These measurements are used in the breath delivery strategy of PAV Plus. Once patients require an invasive artificial airway, there will be an associated increase in the resistance a patient will experience. PAV Plus provides for automatic compensation for the increased resistance caused by tracheostomy or endotracheal tubes. The primary setting is percent support, and it can vary from 5% up to 95%. In this example, we have set the percent support at 50%. This means that the patient does 50% of the work and the machine will do 50% of the work. As this support pressure is applied, you can then see the patient's work move down into a reasonable level indicated by the green zone. There are a multitude of pathologies that can result in the need for mechanical ventilation. Within these disease processes, we can see direct causes for increases in the work of the diaphragm. One such cause is an increase in airway resistance. Whether it is edema, secretions, or bronchospasm, this will impose an additional workload on the total work of breathing the patient experiences. Another common cause is an increase in elastance or a decrease in compliance. With acute lung injury, it is not uncommon for alveolar collapse to occur, which increases the work a patient experiences as well. As you can see graphically, the patient's total work of breathing as displayed on the work of breathing bar would increase above comfortable levels as shown in the green area. By adjusting the percent support setting up to 75%, we can see that the patient's portion of the work moves back toward a reasonable work level in the green area, even though the total work is still elevated. Patients can experience significant changes in elastance and resistance during the course of the mechanical ventilatory support, and it is the automated maneuvers of elastance and resistance that keep the delivered support appropriate for the current conditions. In addition, as patient demand or inspiratory flow rate and volume change from varying needs, PAV Plus measures these needs and changes the delivery support in response within the same breath to try and keep the diaphragm in an optimal environment. It is all of these measurements working in harmony to constantly assess areas of work that a patient may experience and changing the delivered pressure on a breath-by-breath basis that keep the patient in a reasonable work environment. Once the underlying pathology has sufficiently reversed and the associated work caused by these initial changes reverses, we will see the total work and patient work decrease. This, coupled with clinical assessment, would indicate that a reduction in percent support is allowable. This change allows the patient to assume a greater percent of the total work associated with breathing. Mechanically ventilated patients will face a number of variables that will increase their workload, such as metabolic changes, anxiety, temperature, and pain. As the patient faces these additional challenges of work, note that with pressure support in the face of a changing environment, the preset pressure is unchanging and the balance of work is shifted to the patient as illustrated by changes in font size of the letters. PAV Plus will, however, increase its support concurrently. With PAV Plus, the more the patient pulls, the more support he will get. Patients will get exactly the amount of support that they need when they need it. Yes, to some, PAV Plus will revolutionize the world around them. But to others, it will mean the world to them.